Hello, it's Dr. Rhonda Johnson. Today's Tuesday, April 6, 2021. And today I'm going to be talking about the sad relationship between COVID-19 deaths and obesity. Well, researchers have determined that by the end of 2020, the globally COVID-19 death rates were more than 10 times higher in countries where most of the adults were overweight compared to countries where fewer of the adults were overweight. They found that the risk of death from COVID-19 is about 10 times higher in countries where 50% or more of the people are overweight. Now, here in the United States, we have a problem because more than 40% of us are classified as overweight and obese. Now, dozens of peer-reviewed medical studies have documented that the sickest COVID-19 patients have been patients with obesity. So folks, what causes obesity? Well, obesity is caused by generally eating too much and moving too little. We need to think about obesity as a medical disease because it causes many medical complications. Now, the effect of obesity on our immune system is well understood. Being obese causes impaired immunity. It causes chronic inflammation, and it causes blood that is more prone to clot, all of which can worsen COVID-19. And people with obesity are more likely to have other risk factors for COVID-19, such as heart disease, high blood pressure, lung disease, and diabetes. And people who are obese are more prone to have metabolic syndrome, in which our blood sugars are elevated, fat levels are elevated, and the blood pressure can be high. When obese patients are hospitalized with COVID-19, their abdominal fat pushes up on the diaphragm, which is the big breathing muscle, causes the lungs to have reduced capacity and reduced lung volume, which makes it more difficult to breathe. And we already know that COVID-19 is a disease of suffocation in terms of not being able to breathe at the end. And these airways collapse in the lower lobes of the lung, and most people die from complications that are respiratory related. Now, we also know that obesity is so stigmatized. People with obesity are likely to delay getting medical care because and seek follow-up because they often don't feel welcome in the healthcare environment. And sadly, with this pandemic, the stress, the depression, anxiety, social isolation, many people gained weight during the pandemic. So who is more likely to be obese here in the United States? Well, epidemiologically, the rates of obesity are highest in communities that are associated with poverty, lack of access to healthy food, lack of exercise opportunities, and people who are underinsured. So what should overweight and obese people be doing? Well, number one, please take extra precautions to avoid getting COVID now. Wear your mask, wash your hands, avoid large gatherings, indoors especially. Number two, I'm going to say this, get the COVID-19 vaccine. In most states now, it's opened up eligibility, and obesity is a risk factor in many states. Number three, commit to trying to be healthier, and weight loss will occur. Sometimes we just have to forget about trying to lose weight quickly, forget about the numbers on the scale, and focus on improving our health and wellness. And improving our health and wellness will help get us toward a more healthy weight. And that includes sleeping well, being physically active with activities that we enjoy doing, trying to be less stressed, learning how to breathe and meditate, and learn how to relax and laugh sometimes. So most experts, weight loss experts, recommend setting a goal. One step, one change at a time. And small changes can lead to big changes over time. Some people may want to cut out excess sugar. Some people may want to start exercising. Always, always, always discuss your changes with your healthcare providers. Now, I know personally that losing weight is not easy, and keeping weight off is even harder. But well-known strategies include eating less and moving more, and choosing healthier eating options, such as more fresh fruits and vegetables, and healthier fats, and less fried food, and less fast food, and less processed food. That's food that stays on the shelf, and less sugary fruit. We know that if it has frosting on it, we need to watch that. And limiting our sugar drinks, limiting the amount of time we spend sitting, and committing to increasing acts of movement every day, and then gradually increasing our periods of movement for longer periods of time. Now, I believe in the power of one small change at a time. It takes 20 days, they say, to establish a new habit. So whatever your change is going to be, give it 20 days before it sticks. And don't forget that alcoholic beverages, beer, mixed drinks, and wines, they have lots of calories too. Expect some setbacks, challenges, life happens, change happens. Change setbacks into opportunities. Try to stay clear about your health goals. And as always, consult your healthcare provider. Many health systems have medically supervised weight loss programs, and some people may need surgical weight loss intervention. You have to choose a plan that is right for you. And don't forget to get that COVID-19 vaccine. And for those of us who have more than 10 pounds of excess weight, we'll be working on it, right? I know that I am. This is Dr. Rhonda Johnson. My views are my own. As always, my sole intent is to try to help save lives. Stay focused. Don't let your guard down. And as always, have a blessed day.